For over 35 years, I've been a practicing large animal veterinarian with expertise in dairy cattle management. And as a practicing veterinarian, it is my job to help keep my clients' dairy herds healthy, productive, and profitable. I learned early on in my career that it is far more important and cost-effective to prevent disease than it is to treat disease. And that's the role of a properly functioning immune system supported by sound management practices. A properly functioning immune system can help fight multiple diseases, but the most costly disease for dairy producers today is mastitis, with more than 8 billion in losses each year. That's billion with a B and 9 zeros. A huge dollar loss. With that in mind, let's take a closer look at the innate immune system and its role in protecting the mammary gland from mastitis-causing pathogens. As Dr. Nickerson mentioned, the innate immune system is made up of many layers, and the mammary gland possesses most of these. First are the physical barriers to the pathogen entry, such as teat sphincter muscles, which contract, closing the teat orifice. Second is the epithelial tissue surrounding the teat duct. Third is keratin, a gummy substance produced by the skin lining of the teat duct. Keratin acts as a plug during the non-lactating period and has been thought to contain some antibacterial substances. Although physical barriers are important to mammary gland health and the prevention of infection, probably the most active role is taken by these white blood cells associated with the innate immune system. In a healthy, non-infected mammary gland, the milk-secreting structure, the alveolus, is inhabited primarily by macrophages. These cells continually monitor for pathogens and, if detected, send hormonal and chemical signals called cytokines and chemokines into the surrounding capillary beds. This action causes neutrophils, which are continually moving through the capillaries, to stop and migrate into the area where these pathogens reside. The neutrophil has various types of receptors or sensors on its cell surface which can detect these chemical and hormonal signals. Once detected, neutrophils use a protein substance called L-selectin, which is present on their outer cell surface, to stop their movement or rolling along the capillary walls. They tether near the infection site. There, they initiate a series of events which allow them to squeeze through the capillary wall and enter the mammary gland to search out pathogens. Once inside, neutrophils use receptors or sensors to identify the type of pathogen and destroy it by physically engulfing the organism in a process called phagocytosis. Once engulfed, they destroy the pathogen with enzymes or reactive oxygen agents. In the case of a mastitis infection, these mechanisms are recognized by the dairyman as inflammation and fever in the udder and an increase in somatic cell counts in the milk, which is really the accumulation of neutrophils in response to the pathogen. In working with my dairy herds and in my overall management program, I emphasize the role of somatic cell counts in mastitis and mastitis prevention through parlor management, udder care, good nutrition, and a properly functioning immune system.